Do you suffer with pain? Are you looking for relief? There is help. Welcome to Back Talk with Dr. Steve Lininger, brought to you by Manassas Chiropractic and Rehab. And now, your host.
Thanks so much for joining me this week for Back Talk with Dr. Steve Lininger. I'm Kimberly Henrie, and I'm your host, and today we'll be talking about wellness care. Now, before Dr. Lininger joins us, just a reminder that if you have questions at any time, please visit us at www.chiropractor-manassas.com. Dr. Lininger, how are you today?
I'm doing great. How are you?
Fantastic, as always, and it's always a pleasure to speak with you and learn a little bit more about your practice and chiropractic care in general. We've got an interesting topic today. We've talked about all kinds of injuries and illnesses and conditions over the course of our visits. And here's one that maybe most don't think about, and that's wellness care. What exactly is that?
Well, wellness care is defined by, at least defined in Medicare's definition, it's when chiropractic care becomes supportive in nature. You're not necessarily working towards a goal, and they call that wellness or maintenance care. And they also say that it's no longer reimbursable by Medicare at that point.
Oh, how convenient.
Having said that, many people enjoy the benefits of chiropractic care for a lifetime.
So what are those benefits?
Well, the benefits are typically... New York University did a study of people, a longitudinal study, which means they followed these people for a long time. And they did a huge study, and they published it back in 1998, I believe it was. Mm-hmm. I'm not positive on the year. But they did a longitudinal study, and what they found was these people, they studied them that had seen chiropractors their whole lives. And they found that these people had 400% greater immune systems than the average person. 400%. So they got sick less. Mm-hmm. They had very few incidences of colds and flus, and the times when they did get colds and flus, they got over them much quicker than the average person. So that's a tremendous benefit there in the immune system structure, and that's because there's no interference in the nervous system. Mm-hmm. So the person has no interference in the nervous system's brain is communicating with the body at 100% of the time. How healthy are they going to be? Much healthier. Right.
So this is just from regular preventative or wellness treatments.
Most people came in initially, most of my wellness patients came in initially with some sort of injury or condition that they wanted treated. And it's my job to educate them on the benefits of chiropractic care during that time.
Okay. So
whether they choose to do that, it's always entirely up to them.
So the benefits are overall better health, it sounds like.
Not only better health, but greater energy. I hear people say they feel younger when they're getting adjusted, and they feel like they can move better. They feel like they can breathe better. Asthmatics that I treat, when they go too long without an adjustment, many of them tell me that they have to start using their inhaler again because they're not breathing right. Some people tell me they can't turn their head if they don't routine adjustments when they back the car out of the driveway. Mm-hmm. Hear that one a lot. So greater range of motion, increased energy. Basically, it works against the deterioration of the neck and back, and not only that, but the nervous system in general. So lots of
wide and varying benefits, it sounds like.
Absolutely. You ever see somebody that's stooped over?
Yes.
Bent over, an older person? That can be prevented now.
Nice. Through regular adjustments or regular treatments.
Regular adjustments and something, if they have postural distortions, then we have to do a second step called postural correction. If they're already bent over, we can reverse it too. But we can prevent it by evaluating the posture and removing small distortions with their maintenance care before they get large down the road.
Okay.
Also, the individual segments, when they're routinely adjusted and not misaligned, they don't degenerate. They don't build the arthritis in there. Oh. They don't get spinal decay.
So if you were at risk of osteoporosis or arthritis, would that be something that you would definitely want to look into, I would think?
Absolutely. And who isn't at risk of it? We all are. And that's why I get adjusted once a week.
Okay.
Now,
so
I don't have any symptoms.
And that brings me to my next question is, how often do you need to be seen for a wellness care program?
Well, again, I only prescribe them after active care.
Okay.
So that means when a patient comes in and they have symptoms, we're going to start them on an active care program when they're being seen a few times a week until their symptoms and their range of motion and everything is great or just as good as it's ever going to get. Mm-hmm. At that point, I'm going to say, okay, care from this point on, now we're going to recommend a wellness care plan. It's usually after 6 months or a year of active care, depending on the patient. And at that point, I recommend that patients get adjusted once a week during wellness, but sometimes they can do 2 to 3 times a month. Some patients only feel like they need once a month. So it's really up to the patient and the doctor and what they agree on.
Okay, so just kind of a joint decision, depending on what your needs are.
Like for me, I get adjusted once a week. My wife gets adjusted once a week. It's different for everybody.
So what if I don't have any symptoms? I don't have anything I want to work on, but I'm listening right now, and I'm thinking, well, I want to be healthy, and I don't want to get arthritis. Can I come to you and start a wellness care program?
Absolutely. The first thing I would do is check to make sure we don't have any degenerative issues by taking an X-ray.
Okay.
And after an exam, just to screen for those issues, to make sure we don't have to do any postural correction. We want to look at the posture. We want to look at a typical medical exam with some chiropractic things thrown in there to make sure we get a baseline from where you're at. Mm-hmm. And then where can we take you? So some of my patients have weight loss goals, things like that. Those are all supportive or maintenance in nature.
Okay, that just opened up a whole new line of questions in my head. Is that something that's part of wellness care or chiropractic in general?
Absolutely. There are clinics with chiropractors in them, and I'm not one of them, but there are clinics out there that is the only thing they're doing is weight loss. In fact, sometimes they're not even doing rehab. In some cases, the chiropractors aren't even doing adjustments. They're so busy with their weight loss practice.
Wow.
It's a huge, huge epidemic problem in the United States right now. So chiropractors have training in nutrition, just like nutrition. Well, probably not as much as nutritionists, but definitely they have more training than MDs in nutrition. Mm-hmm. So there is a huge demand for this. I typically, in my practice, I don't do a ton of it. Pardon the pun. But,
I didn't even catch that.
But I do work with patients who have expressed interest in losing weight to me. I used to run a weight loss cleanse program, but that was before the cleanses have become so popular now that most people just do them themselves.
Right.
I used to do them years ago before anybody knew what cleanse was.
Sure.
Now they're popularized, so most people are doing them already. Mm-hmm. And they can do them a lot cheaper than what I could provide for them on their own. So in cases where the patient needs medical assistance to lose weight, mm-hmm. This is typically where I'm getting the questions now. These types of patients with thyroid conditions, things like that, diabetics, and they may have not reported to me as their chief concern. Mm-hmm. So they may have come in with lower back pain. Well, guess what? Obese patients typically also a lot of them have lower back pain. So they may come in with the lower back pain, and they can't go to the gym and they can't do any exercises until we clear up their lower back problem. Uh-huh. So a lot of times, the focus of the first year with a patient or whatever is to clear up the symptomatic problems and get them functioning again. Into year 2, when we go into the wellness care, that's when I'm going to typically address some of those other issues. We may want to look at their nutrition levels. We may want to look at their blood work. We may sit down with them and try to come up with a point. I have a diet plan for diabetics specifically that I put them on. I have a program for diabetics that I can help them reduce their blood sugar levels, primarily a dietary program. We have a program for people with diabetic peripheral neuropathy, which is numbness and tingling in the feet and burning in the feet, mm-hmm. that we work with them on. Some of those we take them on a primary. But a lot of those types of things are after you put the fire out, after you calm the symptoms down. Mm-hmm. After the fire's out, now we can rebuild the house.
Okay. These are things that people deal with on an everyday basis. The diabetes, the weight loss, some of the other issues that you brought up, the thyroid. So do those go into, with somebody continuing to work on those issues, are those considered part of a wellness care plan, or are they still in an active care plan even though it's taking, a longer course of action to treat?
Well, it is technically they're in active care because you're working towards some goals. When I refer to active and wellness care, I guess I'm kind of coming at it from a typical rehab mind frame, which is what the insurance company, those are
Sure.
insurance company terms.
Sure.
But yeah, insurance companies don't typically like to pay for things like weight loss programs, even though they should.
Right.
Because it ultimately saves them money.
Sure.
Remember, they're not really caring about what ultimately saves them money. They're caring about their quarterly returns.
Sure.
But the patients are very, very concerned about long-term when it comes to their body. And so am I. So I think these things are important, and whether, they're classified as wellness, maintenance, or active care, I think technically, yeah, you're working towards a goal. The patient's not doing active rehab care typically at that point, unless we're doing them concurrently, which we've done a few times. But typically, at least in my clinic, I like to resolve the rehab portion first before we look at some of those other issues. I want to get them moving again because motion is life. Now, again, there are plenty of clinics where they're coming in, and the whole focus of the clinic is a weight loss clinic, and those clinics do tremendous work, and God bless them. So I don't have a clinic my clinic is primarily rehab based. But we do offer some of those other ancillary services, such as weight loss.
Which we all have. I mean, none of us, I think, walks into any chiropractor's office and has just one thing wrong with them that can be fixed and then we're done. Which is right. Which is probably why you're doing the wellness care, right?
Right. Well, we try to look at more of a holistic point of view.
Right.
And if you just treat lower back pain, I did that for many, many years, and it got boring. So I felt like I could offer my patients so much more by learning more and providing more services, and that's what we do now.
Yeah, great. Very informative discussion today. I learned a lot. I hope that everyone listening also learned a lot as well. If you would like to book an appointment with Dr. Leninger, you can give him a call. Your phone number is, Dr. Leninger?
703-396-7770.
And your website?
www.chiropractor-manassas.com.
Fantastic. And tell us where you're located so we can find you.
We're right next to the ice cream place, speaking of weight loss. We're on Route 28 in Manassas, next to Klein's Freeze Ice Cream. It's 8214 Centerville Road.
Nice. Well, we are out of time for today. If you can think of someone who might benefit from what we've covered here today, they'll thank you for forwarding this episode on to them. And a reminder that if you enjoyed the show, you can also share us with your friends on Facebook at facebook.com/Manassas Web Radio. Dr. Leninger, thanks so much.
Thanks for having me.
Thank you for listening. To join a discussion, visit us on Facebook at facebook.com/Manassas Chiro. And to schedule an appointment with Dr. Steve Leninger, call 703-891-9501. That's 703-891-9501.